Good morning, good afternoon, or good evening, depending where you are in the world. On behalf of the European Association for Palliative Care Research Network Junior Forum, I would like to welcome all of you to the webinar of the Junior Forum. So as Joanne said, my name is Gina Curita. I'm professor in pain and palliative care at the University of Copenhagen and Rigshospitalet Copenhagen University Hospital in Denmark, and I am chair of the EAPC Research Network. I have today the special task of managing the Junior Forum with the steering committee, which is composed by the Junior Forum members. And on this webinar, which is one of the main formal tasks of the Junior Forum, we have a very tight schedule, but I would like to invite all of you that are not members of the Junior Forum to participate and subscribe to it. The Junior Forum is open to all people that are interested in palliative care research, independent of age and the professional background, and it is for free. You can find more information about us in the EAPC website. I'm going to write in the chat box the link where you can find more information. But I return to the webinar, so we have a very tight schedule today. And the two members of the steering committee are going to host this event and explain the next steps for us. And they are Babita Krishnan, she is a physician and research, work at the Radiation Oncology and Palliative Medicine, Drug Safety per Excel International in India. And we have Silvia Gonella, who is a research nurse, works at the City of Health and Science University Hospital of Turin in Italy. Silvia also has clinical experience in oncology and internal medicine. She's a postgraduate specialization in bioethics and has a PhD in nursing, science, and public health. And Silvia serves as also a member of the EAPC Family Caregiver Reference Group. So Silvia, please introduce us to this webinar.
Thank you again for your introduction. And as Professor Curita has just mentioned, I'm an Italian research nurse, and my PhD was pretty focused on end-of-life communication, and particularly on end-of-life communication in the nursing home setting. And at the moment, I'm co-leading a locally founded project that is related to the topic of end-of-life communication. This is the InCare project. That is an ambitious project aimed to improve communication and the relational skills of people that work in the nursing home context by employing both traditional but also experiential-based methodologies. So I'm really interested in developing new collaboration and networking with people that share similar interests. So please feel free to contact me anytime. Before moving forward in the webinar, I would just share with you some numbers concerning this webinar and sharing with you how this webinar will work. Until last Friday, we had 160 people registered for this webinar, and the registration came from 49 countries worldwide, and approximately 2/3 of you work in the specialist palliative care, and 75% work in a care setting. Professor Piret Paal will provide us a presentation that will take around 30 minutes, and then there are 20 minutes for question after. This should be typed in the Q&A box. My colleagues, Babita Krishnan, will take care of this Q&A section and will close the webinar. I will be the moderator of this section, and I would introduce you Professor Paal, that is the director of the CODIA project, that is a cost action project. She is a behavioral scientist who has been working as a researcher in palliative care since 2010. And currently she is working as a facilitator for the World Health Organization Collaborating Center at the Paracelsus Medical University in Salzburg, Austria. Her research interests are patient-centered care, palliative care education, and spiritual care. She is the author and co-author of more than 25 peer-reviewed papers, numerous scientific proceedings, and also book chapters. Dr. Paal is an active member of the Palliative Care Education Reference Group at the EAPC. Professor Paal, the floor is yours.
Yes, thank you very much for this kind introduction. And as you signed up from different places across the world, I saw quite many familiar names and people, and I am so happy that you have joined us on this afternoon or evening in Australia and other parts of our global palliative care community. I am indeed here to speak about how to make impact with research, but also in particular impact when we speak about international collaboration in palliative care. And my main focus indeed has been on education research. And I am really happy that we were successful to gain a rather competitive funding exactly for developing further palliative care educational measures in Europe. But this project is interesting in that sense that people can still join during the first 2 years of the project. And that's why if you feel after this webinar that this is a network you would like to join, then it's open to you, and it's definitely not a project where I as a project lead, I'm telling you what to do, but it's vice versa, that it's a learning process, and the information that you provide will be synthesized into the project results. Maybe here is a picture from Salzburg from the first meeting of this EU-funded cost action. And we can take the next slide, perhaps. And if we think about research, because I was asked to speak about research, and as you see, there are some typos in my presentation because my original presentations that I just fixed, I fixed also the typos. Yeah, well, it didn't open at this point. So as a teacher, I have to be creative and flexible and go with what we have there. And the question is always why we need to focus on education, research, and collaboration. These are the hard facts from past years, that 65% of the European population currently do not have access to palliative care. And we don't talk about here about specialist palliative care, but also this kind of primary health palliative care services, which are provided by generalists. We can go to the next slide, please. And in research, and in particularly when you are applying for research funding, it is become maybe the second most important thing, that if EU is looking which project to fund, then they look at the excellence. So they look at the group of people who is applying for this funding, and that the second thing that they are even in particularly when it's this kind of two-stage application process, they look at the impact. And there are many kinds of impacts, areas of impacts, and impact, making an impact is a little bit different thing than engagement, so to say. And that's why when we already propose for money, we have to think what kind of impact we are doing, but not only in applying for research funding, but impact can be made in education, impact can be made in policy, impact can be made also in societal awareness, for example, also via collaboration and networking. And yes, so let's check some of these things and some thoughts that I've prepared. So next slide, please. Yeah, so one possibility is that when you think about impact, you are quite enthusiastic and think that you want to change the policy. And I just, for quite purposefully, I took this kind of script from the WHO document that was published in 1990 and is based on World Health Assembly meetings a couple of years earlier. And if you look at these statements, these are very much resembling the aspirations we have today in palliative care in many areas. And in the second place, you see lack of education of healthcare workers, administrators, and general public. So how the impact and to make a policy change is a very complicated thing. And when you write a proposal, you might think, oh, we're going to write a policy. But as a member of a research group, you don't really have the authority to write a policy, because policy usually comes from some kind of organization. So you have to be very cautious in promising that. And that's why you have to always think who are those key stakeholders with whom you can have discussion and conversation, to whom you can provide your evidence so that they would be willing to change their policy. And obviously not the entire policy, but they could just add few words. They could add the word palliative into it. The best example is the Astana Declaration, which was changed 2018. And there are in 3 places, if I remember correctly, you find the word palliative. And one of my students once said, yeah, like thousands of people travel to Astana, to Kazakhstan, and then just added like in 3 places palliative. But you cannot underestimate the effort and the lobby work that was behind that this, these words actually were like put into this document, which 193 countries have now signed, which means that they have signed that their task is to enable access to palliative care services also in primary health care. So it's a very important document. So if you make promises, maybe it's easier to think whose policy you can affect with few word changes, so to say. And usually there are some very good success stories, for example, but to make a change, a bigger change, usually you need to identify the problem, you have to find the solution, and then this kind of, it has to come together with this stream of political and public opinion. So that's why we need to always think how to, how to affect the society. And as we know, how to make societal impact is a good question. And so you maybe might know that 50% of publications in palliative care speak about medicine and pharmaceutical interventions for patients. And maybe then there is some proportion of nursing research and some proportion of psychology research and something about social sciences. But if we would like to make really a societal impact, then we have to start to focus on a societal need. And in palliative care, we have lots of ideology. We have lots of these sentences what we repeat to each other. I think like everybody should die in a home-like environment. It doesn't matter, you know, how long you live, but how you live, and all this kind of beautiful sayings from 1960s. But we need this kind of new understanding of what modern people need. We have to raise their death literacy so that they are aware that they have actually, they might potentially have need for palliative care services, and they start to demand palliative care services early enough, and then the healthcare services and also governments will be put under the pressure to invest into those services. So we have to sort of, through the awareness building, create the need. And then, of course, when we understand more what our, not the palliative care patients, but general population thinks that they need at the end of life, we can integrate that into teaching as well. So that's what I have been indicating into this kind of design loop, that if we understand patients' journeys, when we do this kind of prototyping and designing, we address the cultural and diversity considerations, we can improve the communication. So, and then maybe think about digital solutions on our way. And then we come to healthcare professionals training, and we can really train them in things that matter. So, and that again feeds back to patients' journeys. Thank you very much. So let's go to education now. Yeah, and so this is probably the area that I have been putting most energy in, and I have been part of quite many fantastic European projects where the focus was to develop curricula for undergraduate medical students, for nurses, also interprofessional curricula, and through this experience, sometimes these curriculars are in delay on what happens in the policy making or in legislation. And for example, in Austria, we had this kind of policy change that assisted dying is now possible in Austria, not in healthcare facilities, but outside of healthcare facilities, everybody can help also people who choose this path. And so here we thought, I just present you something that we thought that it is really, really necessary, because we noticed that nurses were not mentioned in this law. Only in preamble, there was a sort of hint that, you know, nurses might be confronted by those questions and the patients might require information. But in curricula, nowhere this topic, assisted dying, in that a nurse's role was included. And so we thought that what do we want to teach to nurses at that point? And obviously one point was to introduce them the law and what are their rights and what they can do and what they don't have to do. But the other thing what we thought is, which was also communicated yesterday in the Lancet front cover or in the editorial in the Lancet, that discussion about hastened death is always very polarized. And people just say yes or no, but with that we prohibit them the development. And so to enhance this kind of ethical deliberation in this field, so that people see that there are different opinions and different experiences, and not only positive, sometimes negative, sometimes there is some moral residue that just comes later. And so that people would be better prepared. We designed a drama-based theater, which is like a 3-hour workshop. And here, usually you would, we were thinking how to use this 3 hours so that people really have an impact. So it will impact their practice and their knowledge and so on. And even before we continued with that, and from my experience, usually you would have at the very end, you think, okay, we need to evaluate it somehow. But even before we started with the course, we already put in place that we need to start to re-evaluate our webinars or our workshops, so that we learn from our learners what they need, what is good. And sometimes negative feedback is absolutely the most valuable feedback you can get. And so we didn't have an evaluation tool ready for that. And later we understood that we need to have a tool for understanding the phenomenon of moral deliberation. Next slide, please. Yeah, so our outcome indeed, and these are preliminary findings, that students felt or participants felt that our workshop on hastened death and dying was a space for an appreciative discussion. So, and how did we understood that or what were the indicators that we just didn't engage but we also made an impact was, for example, the fact that after the workshop, people went to ResearchGate and downloaded our paper that we had written in German language to discuss nurses' rights in this process. So and there were more downloads than participants, so probably the word got around. And we really think also that we have equipped our participants with this kind of confidence that if these questions come up, they can give correct answers, but they also have this kind of efficacy to stand for their own rights as well as for their patients' rights. Sometimes you get a slot allocated for education, which in palliative care, and it is really hard to find, but then you don't have to just think that I will just present slides. So make this little slot impactful, make it like this that people remember. So my colleagues even say that you like to make people cry, and sometimes they laugh also very hard. But I think that's exactly the indication that they work with you. They're just not listening to your content that you provide and then they leave, but they start to think. And I think that all palliative care education, even when we have so little hours, should be very thoroughly thought through, and you really should not only engage, but you should try to make an impact with that. So let's go to the next slide. Now, and now we come to this networking, which obviously is so important because everybody, when we think about education, when we think about research, there's so much going on, but my concern has been for many years already that there is so much experience, but it all remains on project websites. So you make a project and you promise to make a website and Twitter and so on, but this knowledge only remains at these websites, and it is not transferred to our colleagues who definitely benefit from this knowledge. And this that's why I thought that this cost action would be an excellent opportunity to share the experiences and to move forward so that we, with all the little funds we have, last week there was a WHO palliative care research group meeting or initiative group meeting, and everybody said we just don't have any funds. Well, 1990 they didn't have any funds either, but still we have developed palliative care further, so we cannot stop at that. But then the shared knowledge becomes our currency, and that's why we need to collaborate and share our experiences. So let's here is like the project, which is called Collaboratively Developed Culturally Appropriate and Inclusive Assessment Tool for Palliative Care Education, and it has a very positive name. It's a CODIA PC Edu. So every when we meet, then we are like, we have our own secret code. It's CODIA, so it should be very, very, very positive. Next slide, please. Yeah, and we just recently checked also that what we promised to each other when we wrote the application, this group, and so we want to reduce harm, we want to promote access, we want also guarantee a sustainable delivery, and for that we have planned many meetings and summer schools that people can join so they can learn how to think and approach palliative care research and education ethically, how to use the data we have gathered so that policy change would happen, or at least some amendments to policies would happen. And also together we would like to strengthen our networks to find more EU research funding that focuses not only on medical issues, but also more on societal issues regarding end-of-life, death, literacy, and how this phenomenon is perceived these days in European Union, but also in WHO European region, but obviously also globally. So we live in a global world. So where we have to think globally first, but then we have to act obviously based on locally collected data and what is available there. Next slide. Yeah, and so we currently have 6 working groups. And if you go to this webpage of this cost action, maybe you made a photo of this number, or if you just Google, and later I will show you also the addresses where you can find more information about that. So currently we have 6 working groups, and each working group has also several leaders. And so we have a working group for the quality indicators for palliative care education and also testing the CODIA tool. So we will develop a tool that can be tested locally. And then we have a culture, language, and diversity group because this tool will be translated into local languages, and language really matters and words matter. And in quite many languages there has been made a translation what palliative care is, and sometimes it's called not palliative care but palliative cure, for example. So people expect some kind of curative measures also from this kind of care. So we have to be, and there's very little research into it, that how people actually perceive the language we use, and we should be actually very precise, and that's why this working group will deal with language. And we unfortunately, we have most of the participants are nurses and medical professionals, but we would need some linguists in this group as well, who could help us, to understand that how the language works and why we need to be precise how we communicate about palliative care and our findings. Then we have Global Policy and Advocacy Working Group, which is Working Group 5. And that means that we will have advocacy and policy trainings about how to disseminate your findings and what are the best practices for advocacy. So we will start with those workshops pretty soon. Then we have obviously communication and dissemination group. So here we have started to make the same mistakes that every project does. So we have our own web page, we have Facebook, we have Twitter, and we have LinkedIn. So you're most welcome to join and follow us. But we need to sneak into other web pages as well and put our information out there. Then we will have summer schools, which are for capacity building, leadership, and ethics. So people can apply for those summer schools, and this will start next summer. And I think they will be a rather nice ways to collaborate and network and gain some new knowledge as well. And then we have research coordination and methods and impact analysis working group, so where we try to promote the uptake of our results, so which will be quite locally gathered, but then globally presented. And the project began 1st of November 2023 and ends 1st of November 2027. And as I said, it is this kind of open network project where everybody can really join and benefit from the knowledge and participate and even get leading roles. So these working groups can be also altered. So we can add new working groups when we notice that there is a topic that we need to address. Yeah, thank you. So next slide. And of course, as we know, the impact of social networking is quite high, and it's difficult to measure. But in terms of our project and also in terms of what my experiences are from the field of palliative care, we need more linguistic, geographical, and scientific variety in research and advocacy. The big majority, just because the journals, the leading journals, are located in the very resourceful countries, which also means that the most of the authors come from the most resourceful countries, and so they are also quite good with English, for example, and that's why we always feel that we have to stress the importance of publishing in local language in this kind of precise language, using the correct terminology also. And then on the other hand, using this data, using this locally coded data to publish it internationally, so that the knowledge about palliative care doesn't only come from few countries. Recently, I sat around the table with some colleagues who were talking about medication that you would use for sedation. And they were like, oh, do you use this and that and that? And I was like, come on, people, in some countries, you don't even have an oral morphine, and like you are in such a high level, so that some people in some countries can have the feeling that they never will achieve anything, you know. So, and as you see, development in palliative care is very slow. And I think young people like you in this research network, and also old people like you in this research network, Young at Heart, we need all of you, because finding funding for your positions, for your work is so difficult. And we really need to invest in young researchers interested in palliative care education, research, and service development. And if this kind of like higher rank positions in international project would help you to pursue this path, then this COST project is really helpful, you know, to gain a role and visibility in a broader context. So not only in your country, but also internationally. And there is also data that the effect of COST project lasts even 7 years after the project. And all the projects I've been in have led to friendships and further projects. So it's definitely good to join those actions. Yeah, and then we need to promote interactions to increase social networks across the world. And I just saw a comment about Latin America. So yes, we need to strengthen each other also from Australia to Latin America and vice versa. And we need palliative care education and training that resonates with local possibilities and service users' needs. That's exactly where I showed you this kind of loop of thinking, that not like what Cecil Saunders said 1990 or 1960, you know, when she started to build up hospices in UK, but you know, when we are building our palliative care systems wherever we are, that what are our population's needs? And this is really unfortunate that there is too little research into this kind of societal need, and so much more only on this kind of very detailed, you know, how we treat this and that. So I understand that there's a medical field for palliative care, and there are lots of professors for palliative medicine, but we would need also many more professors for, I don't know, social sciences, cultural sciences, linguistics, who deal with the palliative care and have the knowledge also in terms of research, how to interact then with people who work as clinicians. And yes, so we need to focus on regionally relevant scientific outputs that are widely disseminated in national languages using culturally appropriate terminology. So this is something that I already said as well, and I think it's really, really important, not taking things from English language and trying to kind of put it in their local language without thinking how they resonate with your population. And here again, understanding how we speak about death and dying, and how people understand what we are saying about palliative care is so important, and I think slightly overestimated in current palliative care research. But so I think there are 2 more slides. Yeah, so this is just like yesterday, a paper, our CODIA first paper was published, and we chose an Eastern European journal. We hope that with our group, we can also enhance this kind of journals that are not listed on PubMed, but are read by quite many people, and maybe it also enhances this kind of discussion locally. So, for more, I think we need to strengthen the network and build the capacity for introspection and understanding complex webs of causalities that affect human health behaviors regarding palliative care. So there is still a long way to go. And yes, at the end, unfortunately, thank you for listening. Listening is learning. But here I have Codia X handle, but you can find the information on Facebook also. If you put Facebook/Codia, then you can get information there. And we also have a webpage which is called codia.eu. And from there you can go to COST site where you can apply to join this project as well. So thank you very much, and I hope you got some inspiration and further ideas. I have realized that I cannot do everything, unfortunately. So if somebody takes an idea from this presentation and pursues it, I am very, very happy. Thank you very much.
Thank you, Professor Paal, for this inspiring presentation. And now we have around 20 minutes for the Q&A session. So I invite all our attendees to write comments, feedback, and questions in our chat. And Babita will take care of this session.
Thank you, Dr. Piret, for the wonderful presentation. We are now moving on to the question and answer session. We request the participants to submit their questions through the Q&A tab. We can see some in the chat section also. We will try to answer everything. And we have received some questions during the registration, so we'll try to answer them first. The first question for you, Dr. Piret, is how to make outcome-based curriculum and assessment.
Yes, so I think I hinted also in one of the slides or two slides that you always, before you start to measure some outcomes or performance or do some performance assessment, you have to be very clear that what are your goals of your course, for example, and so if you have those goals in mind, then you have to think that what is your teaching strategy to achieve those goals at best, and then you have to put an outcome evaluation in place before you move forward. Because usually what happens in many projects, and this is really awful, and I have been telling the same thing for 10 years, I think, and probably someone else is telling the same thing as well. You always make the course, you always know, maybe even you have the aims, you have the skills and competencies you want to develop. And then at the very end you say, but we have to evaluate it somehow as well, yes? But no, this evaluation and the outcome strategy, and this model of Kirkpatrick is very good. So you can look at what level you want to reach any outcomes at all. Is it just that participants are very happy and smiley after your course, or in my case, everybody thinks I want to make them cry, so I would measure that, like, was everybody crying? Yes. No. So that would be the success rate. No. But then you might have some kind of knowledge that you want to measure. And then you have to see if you measure this knowledge just with some kind of tool, or if you measure the performance, and then you give this kind of tasks that people can demonstrate that they can actually apply this knowledge. So that would be, according to Kirkpatrick, already the first stage of evaluation. And then, of course, again, does it have for example, impact on patient outcomes? So this is very laborious work. So, and usually we never have money for this kind of work when we are just working clinically and then doing also our courses. So, but it is really worth it, as I try to demonstrate with this little workshop that we have designed, and we have put lots of effort into it, and we are still trying to make it better and understand things about this, and new things come up. So it is also this kind of loop. It's not ready, and the problem is really that we don't have the time as well as to adapt our teaching. So some of my colleagues still present, their slides from, I don't know, 2011 or something like that. And that is not respecting our learners either. So I think that we really, have to respect our learners, to invest their time into coming to our courses, and we really have to make it like this, that it matters also. And yeah, so there are lots of good articles about how to make outcome assessments. But if you are not teaching it's called Faustregel in German, yes. So it's this kind of thing that if you're not teaching how to write, then written assessment is not probably the best option here. So if you want to really teach skills, then also assess the skills at the end of the course that you have actually taught to your students. Yeah, thank you for this interesting question.
Thank you. The next question is the experience in work in palliative care an advantage to teach palliative care?
Yes, this is also something that I have been asking myself, that am I even allowed to teach palliative care when my experiences come only from research and with intensive interviews with patients, for example. And in Germany, they have, for example, a law that says that people have to have clinical experience of treating patients if they want to teach in palliative care. But there are some areas in palliative care, such as research methodology, for example, that does not necessarily need, clinical experience. Or I understood also that our colleagues with clinical experience said that they don't know how to teach grief and bereavement really well. So because they just don't know what to teach and how to deal with this topic, so they might need some education or support from other groups. So I think it's definitely beneficial, but it depends on the subject really. And I teach spiritual care, and I teach this kind of very humanist approach, and much of my teaching is based on self-reflection. So I don't really think that how people apply it in practice, it's really difficult, to control when you work at the university. But I still get some kind of feedback that this has been very, very helpful, what I've been doing. So I'm sorry that I bring my own role in here, but it's really something that I have been struggling with, that like as an anthropologist, do I even have a right to teach people who treat people in palliative care? But it depends on a subject, I think. But what I know about good teachers is that they have to be authentic, have the best knowledge about the topic they are teaching, and they have to also know how to pick up their learners exactly there where they are. This is also a skill that you need to remember. Thank you.
Thank you. The next question is, how do you bridge the discrepancies in research competencies between developed and underdeveloped countries for collaboration? Do you have strategies already put in place?
There was a very nice project that focused on research skills, developing research skills in clinicians. And this was led by Daniela Moșoiu from Romania. And the results have been published. This project is called RESPAC, and I think EAPC, Katie, I'm sure you have it, the website and all the resources there. So this was precisely to encourage clinicians who don't have many research skills also to, there's the link. So to tell them also why it is so important to do research, because that's the only currency again that you have to explain why your services are necessary. Yeah, so I hope that you will find some things from this RESPECT project, but also in our project, in this CODIA project, we will focus and we will really help people to, if they have, we tell them how to collect the data based on this CODIA tool and also how to get it analyzed and published. So they will get this kind of mentoring from our group members.
Thank you. The next question is how to do competency-based assessment of students in palliative care. I think you already answered it partly.
Yeah.
So we also have a question on what are the opportunities for education, collaboration, scholarship, etc., to improve the palliative care in non-European Union countries?
Yeah, this CODIA BC Edu project is precisely for also for non-EU countries, and even globally countries can join, although there is a limitation that if you are not from European continent, and then you can attend the on-site meeting only once during the project lifetime. But otherwise, if there are online meetings or the information, everybody can has access to this information. So, but we have this kind of, in this cost idea is to invest into people who come from target inclusiveness countries, and these are usually these less resourceful countries, and it is an opportunity really from the people who are not usually part of this kind, like even EU, to join this project and enjoy this project as well.
Yeah, we have a question from a lot of members. You have 6 working groups, as you mentioned, but how to join these working groups? Is there any requirement, any qualification needed? Is there any funding options for participants who wants to join these groups?
Well, if you join it, it's you have to go to the COST EU website, and then you have to find this project, and then you see the work. You have to fill out your CV there, and then you can apply for any of the working groups. So I think you can just look and read, but our working groups very much work together. So there is this kind of interlinked, so you are not allocated only to one working group. So, if now the leadership is more in the hands of working group 1, who is developing this tool, then in the next stage, it will go over to the working group that deals with language and culture. And then, we start to produce the research results. So you have the leverage to move between the groups and benefit from all groups. And the funding is basically, I think we have now 28 countries involved and maybe 100, I didn't check, but maybe 40 people have demonstrated their interest to be part of that. So we want to encourage young people to join, and young, according to COST, is under 40. I'm so sorry, I didn't make this rule, but this is a European rule, and so we really want to see that they also have that. You have to write this kind of explanation why you want to be, and if you say that you are interested in palliative care education, and if you demonstrate that you have done something, or you bring in a very special skill, maybe you are good at drawing pictures or making comics or something like that, then we would love to have you in our amongst us as well. So yeah, so it's pretty straightforward, and until the second year, basically everybody will be accepted. But what happens then with you in this group depends on totally how active you are. So yeah, there's the link where you have to go to apply to be part of that. But you can, of course, just follow what is happening, and we try to tell, yeah, what's happening also. So, but it's always nice. I would really encourage that if you are just like maybe new to the field, or you think that you want to benefit from this knowledge that is in this group, we have also this kind of visual image that we are the fire group, like those who wrote the proposal, and we want to light the torches for the future, who carry this torch to the future, and then enlighten the issues regarding palliative care education. And also organizations can join. We have currently EAPC is our sort of organizational member, and that is focusing on educating former Soviet Union countries in palliative care, is also our organizational member at this point. So, and they are, we call them our thunder group, so they make noise about the things that we do.
Thank you. And we have a question from Roman. The question is, do you already understand what will be the next steps after the Korea project is completed successfully?
Well, then now we should need to define what is the success, but I think that if this goes as planned, we will have quite good data what is happening locally in quite many countries, and the more people join and are ready kind of to contribute in terms of collecting data and testing this tool in their countries. Currently, we just have 3 quality criteria for palliative care education. It is undergraduate education for nurses and physicians, and then postgraduate education for physicians. This was published 2021 by WHO. And I think this is way too little, because we have in palliative care so many professionals whom we also have to support and encourage to gain the knowledge about palliative care. And this has to, therefore we need much more differentiated quality criteria also for the assessment. And I think also like database knowledge is power, so we can use this to just also to build better curricula, which maybe are not like as I said, with this kind of that are more based on medication that we have at our disposal in our location, and not thinking about medications that some other countries might have and we have never heard of. So how to work locally with the. And I have seen how nurses are very nifty in many countries with this kind of things, that using local skills and knowledge is to help people at the end of life. So I think it's really too early to say, but we at least will also aim to submitting from these groups. We hope that the collectives form that will submit also proposals for EU funding, for example. So that's the general idea of costs as well. But we can do a second cost as well and see what kind of impact we had. So there are many options.
Thank you. The next question is from Anna. She's asking that you spoke about the translation and adaptation of you spoke about the translation and cultural adaptation of instruments as one of the stages of the proposal. Is there any intention to translate and adapt these for South American countries?
Yeah, we have an Argentina has said that they are interested in joining, and Tania Pastarana is also part of our group. So she's from Colombia, I think, if I'm not mistaken. So I'm sure that there will be also translations available, but local testing depends on how active and the participants then are, and if they try to test it locally as well, which might lead then to some nice student work. So like master thesis or PhD thesis even.
We have a question from Mr. H.K. Daj. I do feel the research findings RESPECT needs to be disseminated amongst the policymakers, grassroots level healthcare workers, and communities at large. So do you concur with that?
I have to check once more what it is. RESPECT?
He feels that the research findings RESPECT, RESPACC, needs to be disseminated among the policymakers, grassroots level healthcare workers, and communities at large. So
yeah, and this is a perfect example. This is a perfect example of a wonderful EU project that has been now finalized, and EAPC has been disseminating this information. I know, even though I was not involved in this project, but I know about this project. But it would be really important that you know, that's why we need this kind of network and collaborating, that now we also come together. And I can tell you about the project that my colleagues did just because I by accident know about this, and I think it was a marvelous achievement. So when they have very good things, and that's why we need to talk to each other. And so not that someone, I don't know now who posed this question, that you're sitting alone and think like, how do we teach clinicians research skills? And you start from zero if we already have some good stuff out there.
So we have you have this event posted in your CODIA website, that is face-to-face working group meeting scheduled between June 27 and 28, 2024 in Armenia. Is it open for other researchers in palliative care? Do you have a webcast for the same event, or is there a registration link? Considering it's a face-to-face event.
Yes, there will be indeed an event in Armenia. There will be a summer school in Armenia, which is for the less resourceful countries. I saw Roman there. Maybe you can post about the summer school. That is applicable to a few countries. And then we have indeed our COST face-to-face meeting, which is mainly to the members of the Working Group 1. If you have applied, and if your application has been accepted, and if you have indicated that you want to be in the Working Group 1, then you must have received an invitation. But I suppose that most of people in this group have not received it yet because they have not signed up for the project. But there are some slots still free, so feel welcome and we will send you an invitation. But it's based on, we have a fixed number, but it's a first come, first serve principle also for all the further activities as well.
Thank you, Piret, for this interesting discussion. The time is almost out, so we are going to close this webinar.
We have a final question for you. Is the CODIA membership open to the researchers? Not the working group membership, the CODIA membership.
Yes, researchers, clinicians. Yeah, you have to have some degree, but basically it's open to everyone. Yeah. So please join and see what happens. Be adventurous.
Thank you. Now that we have come to the end of our webinar, on behalf of the steering committee, I would like to thank you all for your wonderful participation in making this webinar a great success. We had participants from 49 plus countries gracing this webinar. We are looking forward to arrange more such sessions in the future, and we have some announcements before closing the session. We have our EAPC Research Network Junior Forum session in the upcoming EAPC Congress in Barcelona, Spain. We have invited several research experts and the winner of the Yearly Researcher Award to share their knowledge with us. We are yet to receive the final confirmation about the speakers from the organizing committee. Once we receive it, we'll be sending out an email outlining the program agenda. The session timing will be 9 a.m. to 10:30 a.m. on Saturday, 18th May 2024. Our Research Network Chair, Gianna, and our steering committee members, Carolina and Sylvia, will be there to receive the attendees. We have a few more announcements. We have a dedicated mailbox. I just typed that in the chat box. You can note it down from there. And we have a Twitter or x.com handle. We had a LinkedIn page which we created in January 2024, but we had to deactivate it, unfortunately, due to some operational issues. So, and for those of you who want to join the Junior Forum or get added to our mailing list, there is a link to contact us in our EAPC webpage. Kindly make use of it. And I would like to thank you all once again for this wonderful time spent with us. Thank you.